Welcome to Autism Knows No Borders, a podcast where people connected to autism inspire change and build community. Together with the Global Autism Project, I'm your host, Rachel Harmon, a professional with over a decade of experience in the field of autism services, outreach, and advocacy. Have you ever wondered about the level of autism awareness in countries like Egypt? Are you curious about what governments are doing for their autistic citizens? If so, you'll want to listen to these conversations I had at the 8th International Mental Health Conference in Alexandria, Egypt. You'll hear from several people whom I connected with there, including the conference president and Secretary General of Mental Health and Addiction Treatment, Menan AbdElmaksoud, the head of Child and Adolescent Administration, Iman Gaber, the president of the Egyptian Autistic Society, Dahlia Soliman, self-advocate Rami Alhadinziden Sayed, as well as several family members and professionals in the field of autism services. In this episode, discover what's possible when awareness improves access.
My name is Menan AbdElmaksoud. I am the Secretary General of Mental Health and Addiction Treatment in the Ministry of Health and Population, Egypt. And I'm originally a professor of psychiatry in Ain Shams University.
Great. And could you explain what the objective of the recent conference in Alexandria was?
Of course, we chose the month of April to make use of the international interest in, the International Day of Autism. And then we came up by having more scientific depth for the problems of autism, of autistic patients in general. I think the conference covered it all. We had new trends about biological markers. We talked about scientific projects. We talked about the burden on the families. I think and even the patients themselves were there, and they expressed themselves and gave us a little idea about how they live and how they use their strengths and how they cover their weaknesses. I think it was very nice for everybody, and it was very fruitful. We still are receiving congratulations from everybody.
Yeah, it was amazing. I was really impressed with the level of action that's already happening in Egypt. So you guys are doing an amazing job.
You reminded me a very important thing. The level of policy involvement, or the policymakers' involvement, and having His Excellency, the Minister of Health, by himself talking about autism in a scientific way that even beyond our own experience, that was very impressive himself. He attended the opening ceremony. He himself was talking about the new trends in discovery and new trends of early detection. He was very happy to launch the initiative, the presidential initiative about early detection, early intervention for autistic patients. I think engaging such a level of policymakers is really something to be proud of, and something very interesting for us all.
Yes. Yeah, that's where the change happens. Yeah. So what are you looking forward to with this collaboration with Global Autism Project?
We are looking forward to increasing the international attention, as like I told you, to make sure that Egypt is a part of the projects going on all over the world for interest of autism. And of course, also to get more experience, to get more knowledge, more training possibilities and training opportunities for our young doctors and young caregivers in general. And of course, to give better life and better services for the patients with autism.
Yeah, amazing. We're looking forward to this partnership. Thank you.
The same here. Thank you very much. It's been a pleasure for me to meet you. Thank you.
My name is Iman Gaber. I am the head of Child and Adolescent Administration in General Secretariat for Mental Health, Egypt. And I'm the General Secretary of this conference. My role, we are in the Ministry of Health, have a sector responsible for mental health. My department is responsible for the child and adolescents from 0 to 18. And last year, we're trying to extend to 0 to 24, the early years also. We are providing some services through our teams. We have 15 teams around Egypt, multidisciplinary teams, psychiatrists, psychologists, social workers, and nurses. Also, we have a role with integrating and coordinating with other sectors in the Ministry of Health and other ministries like Ministry of Education, Ministry of Social Solidarity, to improve and to enhance the mental health.
Great, thank you. And so yesterday you mentioned an initiative to increase the awareness of autism for parents with younger children. Can you talk about that?
Okay, autism is part of our activity that we have been for years now trying to improve services for it. And as we all know, the early detection, early intervention is one of the key cornerstone in intervention with autism. So we have taken a lot of steps to make an early detection through screening parallel to vaccination system. In Egypt, we have a very good coverage rate of vaccination mandatory program in primary health care, around 95%. So if we do MCHAT parallel to 18 months vaccination, will give us a good start. And then we will give them some tips. And at 24 months, we will do another screening. And then we will start to give the parents caregiver skills training, which is a program that have been released by WHO and Autism Speaks to help the parents to improve their children developmental milestone in communication by daily activity. I think for us it was good because it's conducted by non-specialized personnel and conducting in group settings. So it's very suitable in primary health care and for our setting because the number of specialized personnel in Egypt is very limited and very costly. To have a training for those to be specialized, it will take a longer time. So was a good program for us. Also, we are trying to increase the centers that are providing services, specialized services for diagnosis, clinical and psychological tools, and also some intervention programs that based on APA, VB, PEAK. This is programs we already have been trained on. So we have now 4 centers. One is big and 3 is just small one. So what we are trying now to do is to have a 1 center in each governor. We have 27 governorates all over the country. So this is our plan in next 5 years. And I think if we do this, we will increase the awareness campaign and increase the highlighting on autism because this is one of the barriers that make us always, when we go in every April for awareness, the question that we said, okay, we will increase awareness and we don't have enough services. So was one of the major challenges. Now I think year by year, we will increase this.
Yeah.
Yeah.
Oh, that's amazing. And I think the presence here at this conference really is just evidence of how far the community here has come in the understanding of autism. And I'm sure this is due to all of the hard work you and your team have been doing. And so congratulations to a very successful conference.
Thank you. Thank you so much. Thank you.
Hi, my name is Dahlia Soliman. I am the president and the founder of the Egyptian Autistic Society. It was founded in 1999 because there was basically no services for people with autism in Egypt. Our main goal was to increase awareness and try and diagnose early enough to do some early intervention and improve prognosis.
Okay, great. And so what has changed since 1999 in Egypt and, the focus of your mission over the years?
I think a lot has changed. The awareness has definitely increased. We've been doing annual campaigns with Autism Speaks in Egypt here on a national level. We've joined the Light It Up Blue campaign, where we light up the pyramids blue and some of our monuments in blue to gain attention. And so people start speaking about autism and what it is. So the awareness has made a huge difference. Also, we've managed to introduce in several schools and universities, especially universities, which did not exist before, even in our main medical school, sections on autism. Now there are complete programs and even PhD programs in Egypt on autism, which did not exist before. So in 1999, maybe 70 to 80% of the cases I was getting were misdiagnosed. Now I believe that so usually parents come to me and they have an idea that their child could be autistic. So this is a huge change from before, because even of course, this is a lot of it is thanks to the awareness, but and the internet. But at least parents know what to search for now, and pediatricians and neurologists are more aware that this does exist, and so most of the cases are already coming in diagnosed.
Okay, great. And what's in the future for the Egyptian Autistic Society?
Well, when we first opened, we used to say we are mainly a center for early intervention. And that was because most of the students I had were 18 months to maybe 6 years old. And now my students are, they're past even adolescence, they're past teenage years, they're 20s. I have a 30-something-year-old student. So we grow with them. So in the beginning, we were trying to get access into nurseries and play schools. And so we were like advocating with the Ministry of Social Solidarity to let our students be allowed to be at nurseries. And then they grew up a bit. And so we started advocating with the Ministry of Education for inclusive education. And I joined the Committee of Inclusion in the Ministry of Education to gain access for our students to enter schools and then change policies to allow shadow teachers in, and then change policies to make different kinds of examinations for the students. So like multiple choice exams, change the IQ test that was a prerequisite for any person with mental disability to enter a school. We changed that for autistic students to be like the CARS, the Childhood Autism Rating Scale, because we felt that the IQ tests were underestimating their intelligence because they were verbal. And now, because, as I said, most of them have reached the age of university level or even beyond, we are targeting universities. We've signed MOUs with several universities, and we've actually managed to do some nice programs where they can do bachelor degrees and have their shadow teachers with them, or they can do partial degrees, just go in and do unaccredited classes for like maybe just do like one computer class or one design class and get a certificate for that. We're introducing buddy systems into the university. So instead of having shadow teachers, some of the students there can volunteer to be their buddies in the classrooms. We've managed to get them exempt from military service. This did not exist before. On the list of disabilities in Egypt, autism was not even placed on that. So we fought for that and got autism on the list of disabilities, and it's become the process of receiving the exemption is very tedious anyway for a regular Egyptian, let alone somebody with autism. And we've managed to facilitate that process, that they go to a specific clinic at a specific time and meet a specific commission group. So I think that was a very big plus for us. So as I said, our services are growing as the kids grow. So as I said, we first started with just basic diagnosis and entry into preschool and nursery. Now we are trying to access the workplace. We're trying to increase access to employment. We're trying to we're working with other entities that are teaching them soft skills, interview skills, how to do their CVs, what to say in interviews. We've set up a vocational school to teach them skills for those who couldn't finish university or couldn't finish school. Now they can come and learn a skill. Some of the students even finished universities, but were not able to get jobs. So they came back to take more courses at this vocational school. So our facilities grow as the child grows, basically.
Yeah, amazing. All right. Yeah, and maybe what's next, when thinking about the older adults too, because I know this is sometimes maybe a population that might get ignored also, for people who, when they reach their elder years, need different kinds of support too. So
yeah,
it's exciting.
I'll tell you once we get there.
Right.
Well, we're on the way to that, but like I have parents now approaching me telling me, can we teach them marriage skills? Can we teach them how to, so apparently we're still missing a phase. We'll see how that goes.
Okay.
Allow me to introduce myself. My name is Rami Alhadinziden Sayed. I'm originally from Egypt, Cairo. I'm 28 years old. And my connection to autism is someone helping me, being supportive with me, as always.
And so you're autistic yourself?
Yes, I am. I am autistic to myself.
Okay, great. What are some of your strengths and special interests?
Strengths, I have a very good memory. I'm very clever at what I'm doing. I can hear very well. And eye contact.
Okay.
Very good at eye contact.
Okay, great. And
I'm more a visual person, not reading a visual person.
okay. What do you think is something that you maybe struggle with or you would like a little bit more support in your life?
I think I need to get more help. I think therapy would be the best option. It's order to help me to get my goals.
What are your goals?
Improve better, work hard, never quit.
Okay. And so you also have a job, right?
That is correct.
So what is your job?
A high-end catering company called Avec Karim, pastry chef.
Amazing. What advice would you give to other autistic people when it comes to looking for a job or getting a job?
Improvement, inspiring people, giving them opportunities and hope. And learn. One thing to autistic people, learn.
Okay, great. And what are your hopes for the autistic community here in Egypt?
We want to create more autistic centers here around Egypt, help a lot of people to improve, help support parents to support children who have autistic to get better and better.
Yeah.
Because people need help with autistic. Even if you finish high school, they need to go to a program or center. Like it's part of their home.
What kinds of services did you receive growing up?
I received a lot of help from special education, basic skills, everything, resource rooms, educational assistance, so on. And my supportive. She's a behavioral consultant dealing with autism. Her name is Rami Alhadinziden.
Okay, amazing. Anything else you want to share?
I would say I want to continue to improve and improve more to reach my goals. I know everyone is with me. Everyone's being supportive with me at all times.
Yeah. And you're also living alone now, right?
That is correct. I am living alone.
So what was that process like for you towards independence?
It's fun. It's fun. But it takes a lot of time for me to be living alone. And I'm living in a studio and I'm renting it. I don't like living in a big apartment.
And what are some things that you had to overcome to get to this point?
I think needs a little bit of help, like banking system, communication with people like who doesn't understand English. I have to go check with my mom. Everything I need to do, I have to check with my mom. Orderings and so on.
Okay, thank you so much.
You're very most welcome. Thank you.
Hey, Rachel here. Conferences are a great way to network with like-minded advocates while learning new strategies to help your autistic children, clients, or students. Are you a professional eager to stay at the forefront of current best practices and wondering how to expand your services to reach even more families? Or a parent looking for support from others who understand your needs? Or maybe you're a self-advocate wanting to share your story and educate others? Look no further. The Latin American Autism Summit is the event tailored to address these pressing questions and much, much more. Mark your calendar for July 10th to 12th, when we'll gather in the heart of Lima, Peru, immersed in a dynamic atmosphere buzzing with insightful presentations, invaluable networking opportunities, and hands-on workshops led by industry experts. Join us at the Latin America Autism Summit, where together we'll live unforgettable memories and forge connections to last a lifetime. And now, back to the conversation.
My name is Radwa El-Tanab. I'm a board-certified behavior analyst, and I'm autism mom, and I'm the founder of Simplify Center. I'm also a member in the Professional Advisory Board for the IBAO and the Egyptian ambassador in the World Behavior Analysis Day organization.
Amazing. So tell us about Simplify. What are the services that you offer there?
Simplify is created in November 2021, and we provide the ABA services to children diagnosed with autism, ADHD, and language delay, and we provide parent training. We focus on teaching the parents how to work with the children at home, and we provide one-to-one and teaching also the children social skills in very small group settings.
Amazing. So when you think about your son's future, what do you think about, and also the future of all autistic people in Egypt?
That's a very critical question and very important question. For my son's future, for example, and also I think this is something all moms are looking for, is teaching as much as we can our children to be independent. Definitely, this is going to be depends on every child reaching their own potential, but I'm doing my best. There are many barriers also that can affect this, but as a mom, and behavior analysts, we are doing our best in order to teach our children to be independent.
Yeah. What are your hopes for the autistic community in Egypt?
Yeah, my hopes for the autistic community in Egypt is that here, for example, here in Egypt, I want more of the people, the typically developed people, to get to understand more autistic people much more. And then so they can accept them more, so they can understand also that they are different. Also for the autistic community, I hope that in schools they start to accept these kids more. They can teach the children under the autism spectrum. They have the resources and teachers in order to help children or students diagnosed with autism much better in school.
Yeah. It's really important.
Yeah.
Okay, thank you.
Thank you.
Yes.
My name is Fahima AbdElmaksoud and I work in Simplify Egypt. I got my master's degree from Liverpool John Moores and I'm an RBT.
What do you like about working with the autistic population?
At first, I never thought I'd be working with children. And then I just came to do an internship in Simplify Egypt. Then I really liked working there. I learned a lot. I think that they have their own way of thinking, their own way of doing things. And that I do help them, but they help me to understand things. I gain knowledge by helping them. So I felt like my experience with them, there is this reciprocity, and we do exchange information. And I really, really love helping them and see the progress after, they gain knowledge, they gain skills, and that makes me happy.
Okay.
That's it.
Great. Thank you so much.
You're welcome. Thank you so much.
Hi, I'm Sylvie Uliga. I am a mother to 3 beautiful girls, Megan, Seti, and Neo. Megan is 18. She was diagnosed with autism when she was about 4 years old. And since then, it has been a long journey and backing into understanding what autism is and how to better support her and better support our family, because as a first child, everything has been around her and trying to make sure that she lives a happy and meaningful life according to what is meaningful to her.
And where are you from originally?
Originally, I was born in Cameroon, and I left Cameroon when I was about 20 years old. Went to the U.S. as an international student, and right now I'm pursuing a PhD in applied behavior analysis. But prior to that, I have a background in accounting. I had a master in accounting. I became a certified public accountant. Was dreaming of being this big accountant, and But with Megan diagnosis, I kind of figured out that it was better for me to get into a field that have shown that, when you apply behavioral principle into changing someone's behavior, it actually effectively works. And the reason why I did that is because with Megan, we tried a lot of things that did not work. But when she started ABA, immediately I started seeing that her behavior can change, that she can sit at a table and eat. It may require that we break down things to the smallest pieces, but once she learns it, it makes things better for her and better for us. So I just venture into it so that I can learn more and support her and teach her things that I never thought that she could learn.
Amazing. And what advice would you give to other parents when thinking about how to accept their child's autism?
That's a good question. How to accept it? I mean, once you have the diagnosis, you have it. And that period of grief, I will call it that way, it's normal. It's a normal process because you have a child, when that child is in you, growing, you have all these big dreams, you're hoping for your child to be this, I don't know, this big person, accomplish all these things. You have big dreams. In my culture, for example, there's a say that your child should always do better than you. So when you have a diagnosis of a child with autism, and at first, in my case, for example, I did not even know what autism was. So I have to go and Google. And what I found was not what I was expecting. I was in denial, and I was in denial for a long time. So my biggest advice to the parent would be that when you have that diagnosis, that denial period should not be too long because early intervention is crucial. It's crucial for your child to learn the skills that they need to learn in order to thrive. And you want them to thrive at this point. You want them to be able to acquire skills that will enable them to live a life. It may not be the life that you dreamed for them, but it will be a life that is satisfying, based on their diagnosis and based on what they will be going through. So I will advise them to do the research, learn from other parents. Luckily today, everybody's talking about autism now. It's less of our awareness, it's more acceptance. And what is acceptance to me? Acceptance is understanding that things are different than what you expected and be okay with that. But how do you continue to pursue your value regarding that child or regarding your family when the things are different from what you expected? So first recognize that you will have to make some changes in the way that you saw that child. And as I always like to quote Dr. Wenda, you said, if you change the way that you look at things, the things that you look at will change. So now that you have realized that it's not a child that you expected because they have a diagnosis that will not necessarily limit them, but will make them do things differently, then you have to start realizing, okay, what are the other things that this child can do? What are the possibilities? What is available to them? And explore that, expose them to things, teach them the skills that they need. And for you to teach them the skills that they need, you have to accept it. You have to do that acceptance. What are your values? And how do you engage in behavior that gets you closer to those values?
Great. Thank you so much, Sylvie.
My name is Dahlia Soliman, and I'm the founder and executive director for the Alexis Miranda Foundation, based out of Massachusetts, USA.
Mm-hmm. And you're originally from Ghana.
Yes, I am. I'm originally from Ghana. I've been living in the U.S. for over 30 years now, but I do make frequent trips back to Ghana as my organization does work there.
Yeah, and the Global Autism Project actually started our services in Ghana back in 2003. So what would you say is the current level of awareness and acceptance in Ghana?
There's been a lot of progress and a lot of organizations working to create awareness and acceptance. So I think from the time Global Autism started, there's been quite a significant improvement in the awareness. People know autism. They know what the organizations do. They can tell you about autistic people and the challenges they face. So overall, I think there's been a tremendous growth in the awareness section.
Oh, that's amazing. And you gave a presentation about how to empower autistic individuals to reach financial independence. So what advice would you give to parents who are starting to think about that now for their children?
I would tell parents it's never too early to start to think about investing or building some kind of financial independence for your child. As they grow, you actually have limited time to get funds for them or make them financially independent. So the sooner you start, the better. I do understand that when you first get the diagnosis, there are a lot of things that you have to do, but keep that in the back of your mind that you also have to plan to be financially stable in order to take care of them, because autism is a really expensive diagnosis. It's a really expensive journey. So you have to be sure you're not dependent on the government or any agencies for help.
That's great. Yeah. How old is your child now?
My child is 23 years old.
Okay. And so From your experience, what are maybe some of your biggest do's and don'ts?
I would say the biggest don'ts, I'll start with the don'ts, is don't do for your child. Let them do everything. Teach them how to do things. So you do with them. Because I recall when mine was younger, I didn't have too much time on my hands to get her ready before we would go to school or before I would go to work. So there's so many things with her daily living skills that I would be doing for rather than letting her do. And that actually hinders the development and the progress. So you have to allocate time so that you're doing with them, you're teaching them, and that helps them to be more independent. And then for the do's, just have hope and try different things. I'm not one that just prescribes to one mode of treatment or program. The kids are very different. They thrive in different scenarios. So be willing to network, explore, and find out, research and find out what programs are available and try them all out. You never know what will work for your specific child.
Amazing advice. Thank you so much, Lynn. Thanks for tuning in to Autism Knows No Borders. If you're an autistic self-advocate, family member, or professional wanting to change your local beliefs and understanding about autism, join us in Peru this July at the Latin America Autism Summit. You can learn more about this event in our show notes. Thanks for listening. Take care.